Vancaillie has already said, and I'd like to thank you all for coming along this morning. I'd also like to thank GAIN for giving me the opportunity to tell you about the past 4 years of my life. In August of 2004, following a routine hysterectomy, I was left with the most horrendous chronic pelvic pain. A pain so excruciating that sitting was not an option. I can only describe the pain as that of a foreign body, such as crushed glass needling at my insides. My lower back, buttocks, and thighs felt as though I had suffered a severe whipping, and to my dismay, my gynecologist had no idea what was wrong with me. After numerous doctor's visits and many tests, no one could find an answer to my problem, and the pain was becoming worse. Subsequently, I was unable to resume working and to function in my daily life. At this point, my gynecologist referred me to a specialist in sports medicine, who was unfamiliar with my problem, but who referred me on to a neurologist, excuse me, whose findings of a neuropathic cause were inconclusive. Destined to a life of antidepressants and opium-related drugs, I was forced to gather as much information I could obtain from literature and internet research. Through this, I realized that there were others with similar symptoms, and that overseas doctors had been working in this area for several years. On presenting the information to specialists who were treating me, I was told that internet patient and doctor-generated research was unsubstantiated, and to make matters worse, was told that these doctors are all cowboys. At this juncture, when I had nowhere else to turn, I came to know of Dr. Tim Pavy, who was prepared to listen to what I had to say. He was the first doctor who was familiar with this array of symptoms and agreed that my pain could very well be pudendal nerve related. Although it was by now Christmas Eve, he took the time to treat me immediately by giving me a pudendal nerve block. I had 3 hours of blissful pain relief for the first time in 4 months. It was also at this time that something momentous happened. From a particular website called TIPNA, T-I-P-N-A, which stands for the International Pudendal Neuropathy Association, we learned of Professor Thierry Vancaillie from the Royal Hospital for Women in Sydney, who was carrying out a study into the use of Botox for pelvic pain, which at the time was showing great results. At this point, I'd like to take a moment to convey my heartfelt thanks from myself personally and from the other ladies in a similar situation who thus far have been helped tremendously by the selfless effort of Professor Vancaillie. He single-handedly has taken it upon himself to address our plight, and as a result has brought a ray of hope into our lives by setting up the first clinic in Australia to treat women with pudendal nerve pathology. Thank you, Professor Vancaillie, for bringing some normality back to my life. With Dr. Pavy's help, in July 2005, I travelled to Sydney where I met with Professor Vancaillie. He treated me with Botox injections to the pelvic floor muscles for almost 2 years. And although it didn't cure my condition, it gave significant pain relief for up to 6 weeks following each treatment. By 2007, it was clear to both myself and to the professor that my condition known as pudendal neuralgia was not going to be cured with Botox alone. And so it was at this time that I sent off an email to pudendal nerve expert Dr. Eric Bertrand in the south of France, resigning myself to the fact that he might not reply. 4 weeks later he did, asking for my telephone number. My spirits were lifted when he arranged to call me the following Sunday. We talked at length about my condition, and he agreed to contact Professor Vancaillie. He explained how difficult this condition is to treat, and that the long, painful journey to France would be most difficult. My mind was made up. Here was a doctor who could give me the answers I so desperately needed. And since I still didn't have a proper diagnosis in Australia, it didn't take much for me to tell him, I'm coming to France. My medical records were quickly packaged up and mailed prior to my trip. At times I found myself asking, are you crazy going all the way to France? What about the expense? What if the doctor cannot help? Then what? Being in such pain and having knowledge that there are only a handful of specialists in the world who truly know about this condition was enough to make me realize that I'm not going to get this kind of help in Australia. I had two choices: go to France or retreat and become addicted to the many drugs being prescribed to me. Drugs that would sedate me rather than help the pain. Extremely disappointed that women like myself are put into the too hard basket, I was absolutely thrilled when Professor Vancaillie told me that he decided to come to France. And so in July 2007, we arrived in Aix-en-Provence where Dr. Eric Bertrand diagnosed a severely trapped branch of the pudendal nerve. I returned to Australia 4 weeks later, and although still in pain, coped with the return trip much better than my journey out. I have been told that it will take 1 to 2 years for the nerve to recover from the trauma of being trapped. It has been 8 months now since my surgery, and although not pain-free, I am doing much better. No more opioid drugs or antidepressants. Some good weeks, some not so good, but this is the nature of a traumatized nerve. Although the federal government did not support me in my decision to go to France, it has now given permission for Professor Vancaillie to carry out this surgical procedure in Australia. From now on, women suffering this debilitating pain no longer need suffer in silence. Through GAIN, I will endeavour to raise awareness of this horrendous condition and to give support and encouragement to those who are suffering. This condition robs you of a normal life, destroys family relationships, and some have even taken their own lives, simply because the pain is so intolerable and you're often told it's in your head. An email from the Minister for Health states that Australia needs to do more research into this condition, and I thank Dr. Pavy and Professor Vancaillie for wholeheartedly being involved in that research. GAIN has a motto: with knowledge we are empowered. I think is very apt in today's presentation. Thank you.